I had always wanted a baby for the longest. So when he was going to the military and had came home, that was our first thing, was to try for a baby after we got married. Well, we had lost one. The doctor down there didn't even know if that was miscarriage, but I'm about 100% sure. When I showed up for my first ultrasound, I didn't know I didn't have insurance. They told me that it was canceled, that they could not see me. But I was having high blood pressure, I was staying swelled up, and it never even confirmed I had preeclampsia. So honestly, it made things a lot harder because not really getting to know if my child was okay, it really hurt me. The process was about 8 months for TennCare. Just knowing that the Tennessee Justice Center was there to help throughout the whole process, it took a weight off of me. I pretty much called everybody in the family on my side, his side, and was telling them how we got insurance, and we had her at 8:41 on November 23rd. She's the best thing. I mean, she highlights any bad day there is. She's just the best. I'm sharing my story because there is other mothers out there who does need help, and no family should have to contact a law firm to get prenatal care.
Monica had worked in the corporate world and did have insurance. She left that. She took another job and she was uninsured. Monica had I call it a freak accident. She tripped and she broke her toe. Evidently, that injury months later caused a blood clot and it traveled up to her heart. If it's caught, they can give you medication to dissolve it, but hers was never diagnosed until the day that she went into the hospital. When it hit her, it was like a storm. And they said that she had multiple blood clots in her lungs, and then ones in the heart is what took her life. I've lost a husband, I've lost my parents, grandparents, but when I lost my daughter, that was so different than any other loss that I've ever had. Monica is an advocate for other people. When I speak for the other Tennesseans who are in the gap, this is why I do it. It's just my way of honoring her. The Tennessee Justice Center gives me the tools that I need to be an effective advocate. I advocate for the 300,000 Tennesseans who are uninsured and help other people understand how serious this matter is, because no mother should have to bury their child because of lack of insurance in the state of Tennessee.
Claire, she had her heart repaired at 4 days old, and the day we were going home from her heart surgery, we were told that she has a genetic disorder. She's required around-the-clock care since she's been born. When Claire was born with her medical problems, I became her advocate, not who I am to give up on my daughter and not try to fight for her, and not just her, but all these other kids. You know, very different diagnosis than Claire, but still the same story, unable to access the resources that they need. Basically, 49 other states in the country provide Medicaid services to children with disabilities except Tennessee. The Katie Beckett waiver stands for is Claire, kids like her live at home with us and with their families and receive the care that they need in the home versus in an institution. Couldn't live without her with me. It goes against everything that's natural inside of me as a mother. Without the waiver, we would have to decide if we stop therapy or of us quitting our job. We have meaningful careers. We bring a lot into the community, and it's hard to feel like it's not reciprocated. I support TJC because they have supported me. It's what I needed. Someone to say, our state needs to fix this, and you're in the right place, and we can do this.
I'm proud to say that Tennessee has finally joined the rest of the nation and passed the Katie Beckett waiver last week. For me, this has been an advocacy journey 4 years in the making. But this would not have been possible without the tireless efforts of mothers across the state, sharing their personal stories, and the mothers before us who paved the way. It also means that going forward, families who are devastated by their child's new diagnosis won't have to worry the way that we did. They can focus on their precious children instead of fighting for basic health care.